We have an opportunity today to talk about testing. There seems to be a lot of confusion and certainly a lot of questions about testing. And so we've brought in one of our experts here, Nate Checketts, who's the testing branch director for the state's COVID-19 response, to help us understand the importance of testing, what it means, how it happens, and what's going on, and some of the questions we have. And I think that's an opportunity for us to understand better. So let's invite Nate Checketts to come in, and then I'll ask some questions and you can respond. So come on in, Nate. Okay, Nathan, allow us to happen a little better. I've got a mic here, so I don't have to come and use your mic. But let me just ask the questions here first. I will have 6 or 7 or 8 of these questions. Why is testing so critical in our pandemic response? What is the purpose and the need, and why is it so important?
Yeah, thank you. So testing for COVID-19 is a little different than some of the other testing that we do for other diseases. If you think about something like strep throat, if you get tested for that and found out are positive, then there's an action that we can take that you and your medical professional, your doctor, can go through to address that and treat the disease. Unfortunately, with COVID-19 being a viral disease and the state of our medicine today, we don't have direct treatments for that type of condition once you're identified. So why do we test? What's the importance of that testing? First of all, for an individual, it's important to know whether or not they're positive with COVID-19 or some other disease, whether that's flu or something else. It's also important for those that you are your close contacts. So if you're identified positive for COVID-19 and you've had interactions with other individuals, they need to know too, so that they can also begin the quarantine process so that the disease doesn't spread. And finally, as a state and as a nation and as a world, we need to know the extent of the spread of this disease. And so by having those positive results and having those test results, we know how far the disease is spreading, where it's spreading, what communities it's spreading to. And so it helps inform the state's response. And as you've seen, as we've gone through the pandemic response, there's been periods where there's been stay-at-home orders, there's been mask orders, there's been a variety of things that are part of our response based on that information. So the test results help inform our response, family's response, community's response, and the state's response.
Very good. Thank you, Nate. This is 3 questions that we hear all the time, so I'll combine them together. But how many tests can the state handle? What is our capacity? That seems to be a little bit unclear. It's varied and certainly has grown. But how many tests can the state handle in a typical day? Who should be tested? And do you have to have symptoms in order to get tested?
Yeah, thank you. Yeah, we've had an incredible journey here in the state and in the country in our testing capacity. If you go back and look at March, we were able to test hundreds of individuals. At the end of the March, we were up to 800 individuals that we could test in a single day. And that was maxing out the capacity of all the players that were involved, the state lab, ARUP, Intermountain, and that's all we could do. And at that time, the type of extraction we were doing were actually requiring manual effort. There were manual kits, and we were trying to find manual kits. And if you remember back from those days, we were putting out releases saying, hey, we need more extraction materials. We can't find extraction materials, working through that process. We've come a long ways from there. We are now up to a capacity of around 9,000 a day that those labs and other partners can do. We are moving it. We are well into automated extraction and automated processing that allow us to get to those types of numbers and be able to do that on a daily basis. And we continue to add to that on a regular basis too. All of the labs are working on improving their processes and working through ways that they can add additional capacity, whether that's buying additional machines that allow them to process things faster or additional numbers, whether that's bringing on additional staff. And that's been one of the pressure points we faced as we've sought to increase the state's testing capacity, is to try to find qualified individuals that can come in and help us operate these machines in the labs, and also looking for new ways, new ways of completing our testing. So who should be getting tested right now? For many months now, we've had out as our statewide guidelines that individuals that are symptomatic should get tested. There's 6 symptoms that are up on our state website. Hopefully everyone is familiar with those. We talk about having a fever, a cough, a sore throat, shortness of breath, muscle aches or pains, or a decreased sense of smell or taste. If you have any of those 6 symptoms, you should go get tested. Our systems, our healthcare systems, our referral systems, our healthcare providers are set up to help you, if you have one of those 6 symptoms, get tested. There's also some other individuals that maybe don't have those symptoms that we would also want to encourage to get tested. And that's if individuals are a close contact of someone who has been positive. That puts you in a high-risk situation, and you may be the next person to get COVID-19 because of that exposure. So individuals that have been within 6 feet for more than 15 minutes of a positive individual are identified as a close contact. We work, as the test results come in, those are passed on out to our public health staff around the state, and they actually go out and try to help you identify any of your close contacts, so those individuals can be identified and notified that they are at risk of COVID-19 because of that time that they spent as a close contact with you as that positive individual.
Very good. There's a number of different tests we hear about out there. Can you explain the difference? Are there all the tests the same, or what are the differences between the different variety of tests out there available?
Definitely. Yeah, I'll talk a little bit about the 3 primary types of tests that we have available right now, and also a little bit about how we collect those samples, because they're a little bit different for some of those different tests. The first one is commonly known as the PCR test, the polymerase chain reaction test. And that's the one that we think of mostly. When you think of someone saying, I went and got a COVID test, it probably was this type of test. And you've seen the pictures. Most of these are done through a nasal swab that goes up through your nose, back to the back of your throat in many cases, to get that sample. That sample is then taken and sent to a lab where they can do high throughput testing with a high complexity test that's very accurate. But it needs to be run in one of those high complexity labs. And these tests are the ones that we believe are the most accurate in the system and telling us how to get those results. And so when we talk about capacity right now, that's generally referring to our PCR capacity. How many tests do we have access to? How many can the state labs run? And that's when we're talking about the 9,000 or so a day. In addition, there's another type of test that can also diagnose current infection it's called an antigen test. It actually goes through and looks for proteins on the virus, and if it identifies those, can help identify whether or not you are a positive individual or not. One of the advantages for these antigen tests is that the current products that are coming out are rapid tests. And so the turnaround time on some of those antigen tests are actually in the 15 minutes or so. Now, some of these tests that are coming out, they are good at telling us whether or not an individual is positive. So if you are infected right now, it will help you know whether you're infected. Where they're not quite as accurate as the PCR tests is that sometimes if you're positive, they're missing that. They're not always telling us every time that someone is positive. And so your healthcare provider may work with you. If you take an antigen test, or if you receive an antigen test, and it is negative, your healthcare provider may look at your situation and say, you know what, there's a lot of other things telling us that you may be still COVID positive. We're going to follow that up with a PCR test to get confirmation whether or not you are positive or negative. The last group I'd like to talk about is the antibody test. Serves a very different purpose. It lets us know not whether you're currently infected, but whether you have been exposed to the COVID-19 virus and what your body has done in response, whether it's produced those antibodies. One of the things that is difficult for us to know how to use going forward is that with the antibody test right now, and if you are positive, we don't know how long that immunity that would come from those antibodies is going to last. And so it is helpful to know that type of information, and especially on a statewide basis, to look at those antibody tests and know what communities have been exposed over time, what population groups have been exposed over time, and really to what extent the infection has penetrated into our communities. We may only be finding some individuals through the PCR testing that we may find out later through the antibody testing that actually the exposure was broader than what we saw through the PCR testing. Some early results that are coming back from some of the systematic antibody testing we're doing indicate that maybe there's 3 individuals for every one that's been identified through the PCR testing that has been exposed at some point along the way and is positive for antibodies. Lastly, I'd just like to talk real briefly about the collection methodology. So for most of these tests, as I mentioned at the beginning, we're familiar with the swabs. They go to different parts of the nose depending on the swab that's being used with your medical provider. Some of them go all the way back to your throat, some would go part way up your nose, and some are able just to go to the front part of your nose. Or there's also one that goes through your throat. Those have all been approved by the FDA. But there are also other methodologies that are on the horizon, some of them approved with some tests, but not yet with all of them, to look at saliva as a way of collecting that. And then as we talked about the serology test or the antibody test, those are done through blood draws. So there's different ways of collecting those samples for those tests.
I hope they're taking copious notes at home here.
Okay.
Now, if we need to get a test, we decide, you talked about who should get tested. How does a person go about getting tested? Where do you go to get tested? Do you have to make an appointment? And how long does it take to get your results back?
Yeah. So the best way to get tested is to contact your healthcare provider to see if you need to get tested. And we also have available on the state website, if you go to coronavirus.utah.gov, right at the top of our banner, there's instructions on where you can go to get tested. We have a map on our website that lists 74 different sites that are open to the public, and you can actually click on each one of those individual dots that are on the map. It'll bring up the location, the time that it's opened, and any specific instructions that may be related to that specific site. Most of our partners encourage that you go to their referral system first before you come to their site. So you go on to Intermountain site or the university site or the Test Utah site to go through the process, answer the questions, make sure that you're qualified for a test, and then actually get your referral that you can take in. And that speeds up your process once you actually get to the testing center. Some sites do allow you to drive up, walk up. So if you look on our testing webpage, that additional information is available on there on how you can sign up for a test. Related for payments for the test, the way that the Families First Act set this up is that individuals that should not be paying for tests that are covered by their insurance. So insurance is set up according to the Act to cover when a test is medically necessary. So if you are symptomatic, if you are a close contact, if you have a healthcare provider referral, if you have a local public health referral, those tests should be covered by your insurance and you should not be charged for those. If you don't have insurance, you can go to medicaid.utah.gov, and there's a special program that's been set up just for COVID-19 where you can sign up and register and your tests will be covered through that program. And if you don't qualify, if you need additional assistance, you can also go to our hotline, which is on our webpage, or to the chat feature on the webpage to be able to get additional direction on how to find testing that's available for you and could be covered at no cost.
So it sounds like what you're saying, Nate, is that for most people, the vast majority, there is no cost to get a test. All right?
That's correct.
How long does it take to get the results back?
Yeah, so as we look at our turnaround times from when an individual gets a sample collection until the results are posted to their provider, we've been looking at 1 to 3 days, or have been our average over the last couple weeks. We know when we had the surge back in June and through mid-July, with all of that testing volume coming in at once, multiple parts of our system had backlogs as they were trying to process that many tests that quickly. and some of those times were delayed. But now as the testing volume has gone down, the labs are reporting that they're able to move back to their lower testing times. The state lab, as an example, has been able to move its turnaround times back down to around a day, sometimes just a little over a day, but right in that range as its volumes are now more aligned with what its testing capacity is.
Along with this testing, you say we have the capacity to do nearly 9,000 tests per day. And yet the numbers we just saw today is significantly lower than what our capacity is. And people wonder, why are the numbers going down on those who are getting tested? What's your explanation for that?
Yeah, we've taken a look at that several different times over the last couple of weeks because we are interested in knowing those results too. And our best information seems to be that there is less prevalence of the disease in the state, and there's been less demand based on that. As we talk to our sample collection partners, so the University of Utah and Intermountain, and those others that are operating the sites on the front line, they're reporting the same thing and have been over the last couple of weeks, where they've been reporting 20-30% reductions in the number of people coming into their sites. That would be a great development, and we're hoping that that's what the data is showing us, is that the infection rates actually have gone down, and that's why fewer people are coming in to get tested.
Last question, and that has to do, if you're tested positive, what do you do? If you're tested negative, what do you do? You're out of the woods? So answer those two questions and we'll call
Sure. So with a positive test, you need to isolate and be in your home, wear a mask when you're around others, even in your house. You're obviously infectious, and we want you to try to avoid spreading that to others in your household. And you'll need to go through that 14-day isolation period and make sure that your fever's been over for more than 24 hours, and it's 10 days longer from when your first symptom was identified. If you're negative, the way our tests work is really just telling you that in that moment when you were tested, you didn't have the virus, that it wasn't at significant levels. Unfortunately, that's not a sort of a get-out-of-jail-free card that you'll never be infected, or that even if you are tested too early in an exposure, that you may not become infected later, or that it will present itself later. So we do, if you've been a close contact exposure, we do recommend that you continue your 14-day quarantine because sometimes if you're tested early in the process, it's possible individuals develop the disease differently, that up to 14 days you may develop it later. So it's important that you complete that quarantine if you've been a close contact exposure so that you don't potentially spread it to others after that period.
Okay. Maybe one last sum up, Nate, and that is, what's the future of testing? Is this something we're going to have to live with forever? We're going to have this constant, have to go in and get tested as we have symptoms ad infinitum?
Yeah. Unfortunately, my crystal ball, like many others, is probably broke about what exactly our future holds. The way I look at this is that we have made tremendous efforts to get where we are today. And there are many things that are on the horizon for us that we should continue pursuing forward. We hope that a vaccine will be there soon, and that will change some of the dynamic. But until that point, we're moving forward. For example, at the state lab, we're adding additional personnel. We're bringing in additional machinery. Our projections are that we can triple capacity at the state lab coming for this fall. We are looking with your direction to partnering with other states to go out and purchase more of these rapid tests, these antigen tests, to see if we can convince manufacturers to produce these in greater numbers and be able to have those available in the state. It would be a tremendous change in our process if individuals could go in when they're symptomatic and have a 15-minute test and have the results, and then start off that process so much quicker rather than waiting for a day or 3 days. So there's a lot of good things on the horizon. We've been working hard. We're going to keep working hard. Definitely appreciate the partnership we've had with the healthcare systems and the state employees that have been working on this. Amazing effort put in to try to make sure that we're staying on top of this.
Well, thank you, Nate.
Thank you, Governor.
Appreciate your good work and keep it up.